Today on Stewart-Cox Family News. New COVID-19 variants emerge, sparking global health concerns as cases surge. Share your thoughts in the comments below. Now let's see the clip.
Queensland is right now in the grips of a new COVID wave, and as we go to air tonight, hundreds are being treated in the state's hospitals. But with symptoms varying, it's hard to tell which winter virus you might have. A new triple combo test taking out the guesswork.
There's a chill in the air and it's not just the southeasterlies. Everywhere you turn, there's a winter illness. And our hospitals are under pressure with hundreds being treated for COVID.
We have seen an increase in hospitalisations. Last week we had 272 on average per day, and this week that's jumped to 330 per day.
There were more than 2,000 lab-confirmed COVID cases just last week. Right now we're dealing with 3 strains, Flirt, Fluke and D-Flirt, which has recently torn through the United States.
We have a lot of COVID activity at the moment, perhaps the most we've seen in about a year and a half.
It's not just COVID. Other winter illnesses are hitting hard too. There were 2,666 lab-confirmed influenza cases last week and 888 of RSV. With so many viruses going around, experts recommend using a rapid antigen test to make sure you're getting the right treatment.
It's really important you get a test because we have antibiotics for those bacterial ones, and we have antivirals for COVID and the flu, and the sooner you start those, the better they work.
Rapid antigen kits available at pharmacies can now test for other viruses like influenza and RSV, as well as COVID.
Ideally, you do a test as soon as you're symptomatic, so they're most accurate if they're done within the first few days of feeling unwell.
It works just like a normal rapid antigen test. You do a nasal swab, mix it with the solution and put the drops in here. The main difference is it tests for 3 different viruses and you'll have a result within 15 minutes.
Some of the limitations of those, though, is they will miss mycoplasma or a whooping cough if people have those, and they still aren't quite as sensitive as those laboratory-based tests.
The tests cost around $9 each. If you have any cold-like symptoms, the advice is to stay at home. Doctors and pharmacists urging Queenslanders to take advantage of free flu vaccinations and COVID boosters to help stop the spread.
It's definitely not too late to get vaccinated.
Ebony Cavallaro, 9 News.